That means we've discussed epithelial tissue, we've discussed connective tissue, we've discussed muscle tissue, and we've discussed nervous tissue, right? And the function of nervous tissue is to send, receive messages and for communication. So we've talked about the 4 different types of tissue. Now let's talk a little bit about what tissue does in the body. And one really important thing that tissue does is it repairs itself, it replicates. And it does this through a cellular process, which if you had a good biology teacher like Mr. Bergoni, if you had a biology teacher that covered this concept, you'll know what I'm talking about. What is the cellular process that allows cells to multiply through division? What is that process called? Does anybody remember? What is the process of cell division called, where a cell makes a copy of itself? So it's in there, Yara. You just can't remember the word. Okay. All right. Well, I'm sure it's on the tip of your tongue. Good thinking, Jose. Clone, duplicate. Kenya asks mitosis. Oh, I think we're getting somewhere. Any other thoughts? Meiosis. Really good thinking, Stephanie. I can tell you paid attention, both Kenya and Stephanie in biology. Good. So remember mitosis, ladies and gentlemen, also known as cell division. Good, Stephanie. You're making me feel very, very good, Stephanie. So mitosis, ladies and gentlemen, is another name for cell division. Meiosis is a different type of cell division. So they're both types of cell division. Good, so it was in there, Yare. The specific type of cell division where a cell makes a copy of itself, an identical copy of itself, is known as mitosis. So you may or may not remember that word, mitosis. Mitosis is cell division where you make a copy. And then meiosis, it also is a type of cell division, but this is where you make a sperm or egg. So pretty much all of the tissue in your body, for the most part, goes through mitosis. There's a few exceptions. Your ovary and your ovaries, some parts of your ovaries and parts of sperm, they don't go through mitosis, they go through meiosis to make sperm and egg cells. That's it. So now, we know that cells can make copies of themselves. And in fact, when they do this, they are making more of themselves because they take one, like this, and they turn themselves into 2 identical copies. Yes, thank you, Braulio. I didn't see that up there. Now, why is this important? Well, this is how tissue repairs itself. Think about your skin. When your skin gets torn because of something sharp that cuts into it, or maybe some type of abrasion because it gets torn, ripped, it needs to fix itself. It needs to regenerate. So we call this tissue repair. So please write as your next note, capital V period, tissue repair. And, oops, we should be using this. Now, when tissue regenerates, makes more of itself, it does it through the process of mitosis. And when these cells in the tissue need to, and they're usually signaled, a certain group of cells are told you need to now go through mitosis. They will then make more of themselves. And we call this regeneration. So when you get a cut, and we're going to talk about the whole process of skin regeneration when we talk about skin. We have a whole section for skin. When you get a cut, you can't leave that opening in your skin because we're now exposed to viruses and bacteria from the outside world. Blood can then seep out. We'll lose precious fluids, precious nutrients, precious cells that way. The body has to fix that repair. And it does that by telling some of the cells to regenerate. So we call this process where new cells of the same type and normal function are restored. There's another type of tissue regeneration that can happen, or tissue repair, that can take place. And this is known as fibrosis. Now, fibrosis occurs when the tissue is not able to completely build enough cells to fix the damage. This can happen when you get a really bad cut in your skin, for instance, where the cut is really deep, it's really long. You can try to, stitch it together to allow some of those cells to regenerate, but there's just too much of the cut that another process of tissue regeneration takes over known as fibrosis. And this leads to scar formation. This is one of the reasons why, if you've ever had a really bad cut or a bad wound, that you have a scar remaining there afterwards, because it was too severe of damage for the skin to fix it just through mitosis. There were just too many cells to replace, and the body needed to act faster and quicker, so it brought in some extra proteins to cause a scar to form. And it doesn't look like the original skin because it's stuffed with all of these, we'll call fibrinogens, basically. They're these fibrin proteins. And so we'll learn a lot more about that when we get to our skin section. Whether the tissue repairs through regeneration or through fibrosis or both depends on, one, how severe the injury is, or what type of tissue has to regenerate. Whether it's bone that has to regenerate, whether it's epithelia that has to regenerate, whether it's tendons and ligaments, connective tissue that has to regenerate, or whether it's muscle that has to regenerate. Depending upon how severe the injury is and what type of tissue it is going to determine whether the body regenerates through repairs through regeneration or repairs through fibrosis. Now, the body has these two methods for fixing tissue damage. In some tissue, as we get older, we lose the ability to regenerate. So if you've ever seen a small little child get a cut, maybe on their leg or their arm, in a couple weeks, you never even knew that they had a cut. They may not have any type of a scar if it wasn't a very severe cut. But now if an older person got the same cut, the same gash, there would be some scar tissue there. Because as we get older, we lose the ability of regeneration. Our cells get older. They can't replicate as well as they did when we were younger. And the body has to use fibrosis in order to kind of fill in the gaps where regeneration isn't taking place fast enough. And that's one thing that kind of is not too great about getting older. Is as we get older, some of these functions in our bodies start to slow down, and we can't do the same thing we used to do when we were younger. You guys are still at the age where you're not experiencing that yet, Some things are slowing down, but when you get a little bit older, like into your 40s, 50s, 60s, you'll start to realize that the body can't really do the same type of tissue repair that it used to be able to do when you were younger. Things take a lot longer to heal, can be a lot more dangerous. So depending upon how severe the injury is, you can also say, depending on how old the person is too, how old the tissue is, also can affect whether regeneration or fibrosis happens to try to repair the tissue. But what we're going to do first is we're going to look at tissues that can regenerate, that have the ability, whether you're young or old. And then there are some tissues in the body that will never regenerate. They can't regenerate. They don't, cells in that tissue don't have the ability to go through mitosis. And if you were in my biology class, you remember we talked a little bit about this before. So tissues that can regenerate. One example would be your epithelial tissues. So the tissues on the outside of organs, on the outside of the body, on the inside of passageways. If there's damage, that tissue can regenerate. Loose and dense connective tissue, ligaments, tendons can regenerate. If an organ gets severely shifted, pulled, that damaged connective tissue can repair itself. Bone has the ability to regenerate. If you've ever broken a bone before, you know that. Doctor or a nurse probably put that leg or arm or finger into some type of a cast and then let it sit in that position for a month and a half, 2 months. And then after that time's passed, elapsed, that bone has gone through regeneration, so you can take the cast off and the bone works again like it used to. Almost like it used to. Same thing with our blood. If damage happens to our blood, whether it's the red blood cells, white blood cells, platelets, or even plasma, the non-living matrix, all that stuff can be regenerated, it can repair. And the last example is smooth muscle. So notice I did not say heart muscle, cardiac muscle, or skeletal muscle. I said smooth muscle. So smooth muscle is one of those 3 types of muscle tissue. We find it in our blood vessels. We find it in some organs. It has the ability to kind of dilate and constrict passageways. That can regenerate if needed, if it gets damaged. But that's pretty much the only tissues in the body that can regenerate if they are damaged. And again, depending on how severe the injury is, that's going to determine how well these tissues can regenerate. If you were to lose a big chunk of your skin, even though skin has the ability to regenerate because it's epithelial tissue, you may not be able to regenerate that spot. So you may actually have to take skin, we call it grafted, from another spot of your body. Usually they take it from your rear end, sometimes from a big part of your leg, and then they cut it off. They sew it to the area where the missing skin is, and then they let the regeneration process fill in the gaps. So as long as it's not too severe, these tissues can regenerate. But then that would mean if there's tissues that can regenerate, there are tissues that cannot regenerate. So now, number 7, VII, tissues that don't regenerate. These are tissues, when damaged, that cannot repair themselves. Mr. Monzo is asking, so when wisdom teeth are removed, will the wounds close? Yes, that's the idea. Your gums are epithelial tissue. It's a type of skin. And so the epithelial tissue there has the ability to regenerate. And that's why they stitch those holes nice and close together, and it's painful because the skin's being pulled together. And then as it's being pulled together, there's less space for the skin to have to regenerate in the gums. So they have the ability to go through mitosis, mitosis, mitosis until they're now one skin. There's no opening, and then they take the stitches out, and then you have no more hole there. It's a good question. Here's tissue that cannot regenerate. Skeletal muscle. So these muscles that we use to move our bones, they can't regenerate. When they're damaged for good. So if you had like a bad puncture wound through a muscle, you'll always have that damaged tissue. So that muscle will never be 100%. Cardiac muscle also cannot regenerate. That's the muscle that makes up the walls of your heart. And this is why it's so important when somebody has a heart attack, when blood flow stops to the heart and those muscle cells start to die, they don't regenerate. You don't get new heart cells. And so when somebody has a severe heart attack, they're severely compromised. They're severely injured for the rest of their life. The heart doesn't repair itself. So you got to take care of your heart. And you got to take care of your nutrition so you don't block off any of those little blood vessels that send blood to your heart. Because once they get damaged, they're damaged for good. There's nothing the body can do about it. Nervous tissue cannot regenerate. When we have damage to our brain, to our spinal cord, to some of the nerves that run through our body, we call them the peripheral nerves that actually sense and move things. When those nerves get damaged, they do not repair. They do not regenerate. And that's why when somebody gets in a bad accident and they snap their neck and the spinal cord literally breaks, that person's probably going to lose the ability to use those nerves anymore. And then last is cartilage. Cartilage, remember one of those types of connective tissue? Cartilage cannot regenerate. If somebody was to cut a piece of your ear off, it's not going to grow back. We don't have the ability to grow this cartilage back if we lose it. If you lose your vocal cords for some reason, they're not growing back. Body can't regenerate that stuff. And so we just have to be aware of skeletal muscle, heart muscle, nervous tissue, and cartilage. These are very precious to us, and we want to try to keep them as safe as possible. Okay, that's where we're going to stop for today. That's actually perfect timing too. So please make sure you get this last slide in your notes. And we have about one more section on tissue where we're going to talk about what we call pathology. Please write all of the questions for anything that's been underlined for your homework.